Hi, this is Dr. Brian Heaberlin here with Lexington ENT and Allergy. I wanted to discuss one of my favorite topics, and that's chronic sinusitis. As an otolaryngologist, we see many patients with chronic sinusitis. It's probably one of the most common things that we see in the office. Chronic sinusitis refers to an inflammation in the sinus cavities, which are air pockets off of the nasal passage. We have frontal sinuses, maxillary sinuses, ethmoid sinuses between the eyes, and we have something called the sphenoid sinus, which is kind of in the back part of the nasal passages, and it almost feels like it's behind your eyes sometimes. So chronic sinusitis is when there is inflammation in those sinus passages for 12 weeks or more. Often people have chronic issues with recurring infections in the sinus passages. So if you're getting more than 3 sinus infections a year, it could be that you never really resolve those sinusitis episodes and you have a chronic sinusitis. Chronic sinusitis refers more to the inflammation and not really definite infection, but oftentimes infections are what fuels that inflammation. But it's not the only thing. Allergies can contribute to the problem. There's really a lot of different factors that come together to cause someone to have chronic sinusitis. Some people have a weakened immune system. Some people are around irritants. Tobacco exposure and cigarette smoking can cause chronic inflammation that can lead to these recurrent events. So it's really a complex interplay between a lot of different problems. When people have chronic sinusitis, the symptoms they usually get are facial pain and pressure, purulent drainage. Either purulent means kind of thick pus-like drainage out of the front of the nose or down the back of the throat. They can have a nasal stuffiness or congestion, blocked nasal passages where they don't breathe well, and they can also have decrease in their sense of smell or taste. Headaches can definitely be associated with chronic sinusitis, but headaches are often from other issues and not from purely the sinus passage, or not from sinusitis also. So we always have to be a little leery in contributing headaches to sinusitis too frequently. There is a type of chronic sinusitis that has nasal polyps, and I'm going to discuss that in another video, so if you look in the future I'll have that out, but that's a specific type of inflammation. But the type without polyps is about 2/3 of the sinusitis patients throughout the country. Chronic sinusitis can be treated a number of different ways. Certainly a lot of people do end up needing endoscopic sinus surgery, but we have some medical management tools that can sometimes help. Nasal irrigations and topical nasal steroid sprays like fluticasone or Flonase spray can certainly be helpful. Antibiotics can help clear up some of the active flare-ups, but they're really not often going to be curative for sinusitis. Oral steroids like prednisone certainly reduce inflammation, often make people feel a little better with the sinusitis, but often doesn't give long-term resolution of the problem. Endoscopic sinus surgery is sort of our workhorse for managing chronic sinusitis patients, and it's certainly not a perfect fix for the problem, but it usually does improve people's symptoms. The surgery, really the goals of the surgery are to make the openings from the nasal passage into the sinuses a lot larger than they naturally are. Natural openings are only a few millimeters, so if you open them up widely, the sinuses can drain better, air can get into the sinuses better, and that usually will result in a decrease in the inflammation and a decrease in the flare-ups and symptoms associated with the problem. There's some techniques that use balloons to dilate those passageways, and then there's more what I call traditional techniques where you remove some of that very thin eggshell-like bone that separates the nasal passages from the sinus cavities. That surgery is all done through the nose, and people have usually a fairly minimal downtime with return to work within a week or less. So sometimes it has to be combined with other types of nasal surgery, such as a septoplasty to straighten out a deviated septum, but purely endoscopic sinus surgery patients typically don't have a tremendous amount of postoperative pain or complications. So if you think you have some chronic sinusitis problems or know someone that does, we'd love to see them and help take care of them here at Lexington ENT and Allergy. Phone number is 803-936-7530. Thank you.